do anything about it. And as a result of that, you've got a disruption in
Yes, yep.
And so then we try and adjust the biome artificially by putting probiotics in there, but they're not endogenous to the patient. So it's a completely different flora, and they have their own. So we have a product that we use that actually will modulate the pH, feed the natural flora, grow that, and replenish it. And they've got studies to show that if you can bump up the population, and you just think that the population in the vagina did not climb up into the uterus, but that's not true. It actually does.
Right.
And so if you can actually correct the population percentage density, you can actually achieve pregnancy and encourage implantation. Without it, you don't get transport of the egg down the tube, you don't get fertilization, you don't get implantation, all because of pH. And so, it's like, okay, well, here's all of this information. But again, this is about what you are is what you eat. And we've got to stop thinking that things, in my opinion, are working in isolation. So great, we're doing all this genetic testing, these SNPs. And I'm looking around the room, I'm going, okay, well, we know that, so what do you do? And I think that's the missing link. It's one thing to tell them, okay, this is why. But we have to give them practical solutions to deal with the information, because if we don't do that, we're doing them a disservice. And then, we work in an unfunded community, so they have to pay for all this stuff. So they have to pay for the genomics, and then they have to pay for like vitamins, and they have to pay for this. And
to at least sound specific to what they need versus, a shot, everybody needs to take a prenatal, and maybe a little bit of vitamin D.
Wow. I agree with that, and I think that you have. I think you get patients who fall into different streams. In my opinion, I think that doing prenatals has to be. You have to really do your research on prenatals because they are not all made alike. But I think everyone should be on a prenatal. We should know what we're actually giving. Samples are great, but if the sample is crap that you're handing across the desk, why are we doing that? Because it's free. They're about to spend $40,000 on IVF. Like, seriously. Make sure they have a great quality prenatal. And why aren't we managing their uterus? And why aren't we managing their vagina? And why aren't we addressing diet? It's the most important part of their treatment. So if you bought a Ferrari, I know you would put cheap gasoline in there. You go right to the end of the 91 and fill it with the best possible fuel. Eggs and sperm, in my opinion, are fuel for the IVF Ferrari.
For sure.
So,
and then we look at, chronic use of antibiotics for acne with PCOS, or whatever, that way. And I mean, it's wrecking microbiome. Or,
standard of care in Canada, most of the clinics are.
Everybody uses Doxy here. We use Doxy. 10 days.
Free treatment, Doxy before you go
So
in.
with all this research coming out with the lactobacillus and stuff,
Yeah.
it is huge. We're going backwards.
Oh, yeah.
Right? And we're not replacing it, we're
Yeah.
just killing it,
Yeah.
and it's cycle after cycle, because you gotta give antibiotics, right? And we're just doing it.
Right.
You're just doing it, but you're not
Right.
thinking about,
Right.
it's not something that's isolated.
And then we also don't, we don't talk to mom or whatever if she has group beta strep and, she's on antibiotics preventively, before baby comes out. Well, that's also wrecking her flora. And so baby's coming out with nothing, not much. So again, and I see a huge correlation to C-section babies with gut stuff and health stuff than with vaginal delivery babies. Yes, unless mom had antibiotics for group beta strep. I see it all the time. But see, as a naturopathic physician, and I had all C-section babies, but I'm also a neurotic person that knows too much. So my kids are like my science projects, but I knew what to do, like all my kids from birth, probiotics, vitamin D. I gave them colostrum. I gave them, all this stuff because I couldn't breastfeed, so I had to, I actually made my own formula. Don't ask. Don't ask.
I hear you.
But, you have to look at all those things. And so I see such a huge correlation that I've learned over 18 years that I can help patients that if they don't want to do a VBAC, that's up to you, but at least we can help baby, if baby's going to be C-section. So again, there's things that we can do And, you know, from a preventative standpoint, that, you know, sometimes it is what it is. You know, if you have to take antibiotics for group beta strep, you know, then that's something that you need to do, but then we need to protect baby and give baby what baby's not getting now, you know, coming out the, you know, the vaginal canal. And then if you throw the gene variant into that, you know, it can be a lot. So, you know, it's about really focusing on, you know, prevention. So, yeah.
So I have a question about the SNP. How do you test for it?
It's a swap.
Okay.
Mm-hmm.
And so new patients coming into our centers, which companies offer this?
So there's a bunch of companies out there. The one that I use, and I don't get anything from them, but, and I can pass this around. This is actually my genetic test. Don't look down on me or whatever, but I can start passing these around. This is the nutrigenomics test that's women's health. So they have different ones that you can get. Mine is like the whole kit and caboodle, because again, I'm neurotic and I know too much, right? So
No, that's okay.
I know. And so sometimes you have to be the test guinea pig. But so these average in price, and insurance doesn't cover it, nor would you want your insurance to have this. I mean,
No.
this is genetic information, right?
Okay.
So I want to say for the whole kit and caboodle, it was like $430 or $440, and then I don't know how much this one is, but I'm assuming it's cheaper because you're not checking as many genetic SNPs. And then what they do too is they give you,
Sorry?
Yeah, the women's health one's cheaper.
no, the women's health is probably, yeah, it's probably cheaper because the big one is 55 genes, and this wasn't checking 55 genes, so. And then what they do is, and I'll pass it along, but they give you nutritional recommendations,
That's nice.
which is nice, so
Yeah.
here, if you want to pass them around. So when we look at, you know, hormonal issues when it comes to infertility, whether it's endometriosis, PCOS, that plays a role in estrogen balance with progesterone. And so if you have different genetic SNPs in the COMT or the CYP1B1, these focus on estrogen metabolism. If you have genetic SNPs in these, that can also increase risk of hormone-sensitive cancers. If you have a COMT genetic SNP, that also increases risk of catecholamine production excess, which means you might be sensitive to caffeine. This might increase your risk of high blood pressure, heart palpitations, AFib. And so there are things that are very easy to do to work around that genetic SNP, which again then can decrease risk of any hormone-sensitive cancers, help with, you know, any, you know, the PCOS, endometriosis, which getting hormones in balance will help with getting pregnant. And then the FOXE1 is looking at thyroid stuff. You know, obviously that's an organ of endocrinology that plays a role in, you know, ovulation and pregnancy. And, you know, everybody thinks they have hypothyroid, right?
Yeah.
You know, everybody wants that gene to be skinny.
Yeah.
You know, I've yet to see that ever happen, you know, but, you know, that does play a role. And so if you have a genetic SNP, there's things you can do from a nutritional standpoint. So when we look at SNPs in treatment, you know, essentially it's about manipulating around that. So if we look at the MTHFR, essentially you want to supplement with methylfolate. Or if you eat your green leafies uncooked, there's active folate in that food, okay? You can take enough folic acid to like kind of force it through the enzyme. And folate is B9, so it's a B vitamin. They're water soluble, you can't overdose, okay?
I have a question.
Yes,
So if you have the mutation,
Yes.
and you take a synthetic and or not the active,
Yes.
like in place of